Welcome to Glucose. Hi guys, we will talk today about otitis media, but first we will say a hint about ear anatomy. Let's go. Ears are organs on either side of the head, directly over the temporal lobe, and consists of three main parts, including the outer ear, middle ear, and inner ear. The tympanic membrane, eardrum, separates outer ear and middle ear. 1. Outer ear, external ear. The outer ear is the part of the ear that's visible. 2. Middle ear. Middle ear begins on the other side of the tympanic membrane. There are three tiny bones in this area: the malleus, incus, and stapes. The middle ears also house the eustachian tubes, which help equalize the air pressure in ears. 3. Inner ear. The inner ear contains two main parts: the cochlea and the semicircular canals. The cochlea is the hearing organ. The semicircular canals, also known as the labyrinthine, are responsible for balance. Okay, let's talk about otitis media. Now, my friends, middle ear infection, or otitis media, is inflammation or infection located in the middle ear. Otitis media can occur as a result of a cold, sore throat, or respiratory infection. About 3 out of 4 children have at least one episode of otitis media by the time they're 3 years of age. Otitis media can also affect adults, although it is primarily a condition that occurs in children. Okay, let's know. Who is at risk for getting ear infections? While any child may develop an ear infection, the following are some of the factors that may increase your child's risk of developing ear infections. Being around someone who smokes. Family history of ear infections. A weak immune system spends time in a daycare setting. Absence of breastfeeding. Having a cold bottle fed while lying on his or her back. Fluid draining from ear, loss of balance. Hearing difficulties. Ear pain. There are 3 types of otitis. Media, acute otitis. Media, chronic otitis media. And otitis media with effusion. I'm talking about symptoms of otitis media. The onset of signs and symptoms of ear infection is usually rapid. Concerning children's signs and symptoms common in children include ear pain, especially when lying down, tugging or pulling at an ear, trouble sleeping, fussiness, trouble hearing or responding to sounds, loss of balance fever of 100F, 38C, or higher drainage of fluid from the ear headache, loss of appetite. Adults. Common signs and symptoms in adults include ear pain, drainage of fluid from the ear, trouble hearing. Okay, how is otitis media diagnosed? In addition to a complete medical history and physical examination, we will do the following: 1. Inspection of the outer ear and eardrums. Using an otoscope to see inside the ear. 2. Using tympanometry, which is a test that can be performed in most healthcare providers' offices to help determine how the middle ear is functioning. 3. Performing a hearing test for children who have frequent ear infections. Ear infection treatment. Specific treatment for otitis media. According to type of otitis, media treatment may include a combination of antibiotic medication by mouth or ear drops, medication for pain and fever, observation. If fluid remains in the ears for longer than 3 months, and the infection continues to reoccur even with the use of antibiotics, this indicates that small tubes be placed in the ear. This surgical procedure, called myringotomy, involves making a small opening in the eardrum to drain the fluid and relieve the pressure from the middle ear. The child surgeon may also recommend the removal of the adenoids if they are infected. Removal of the adenoids has shown to help some children with otitis media. Long-term effects of ear infections. In addition to the symptoms of an ear infection listed above, untreated ear infections can result in any or all of the following: infection in other parts of the head, permanent hearing loss, problems with speech and language development. That's all about otitis media. Thanks for listening, and see you guys in the next video.